You know, when we chart, oftentimes we don't really necessarily think about how it's going to be looked at later. So when you write something like tolerated well in nursing documentation, which you see documented all the time, but what does that actually mean? So if I come on shift and somebody's documented tolerated well, what am I expecting, right? So, for instance, if your patient tolerated a feed, what does tolerated well mean? I could assume that that meant that they didn't have any vomiting, they didn't have any coughing, they had no increased work of breathing. But maybe you mean tolerated well, meaning they tolerated it well for them, so they had slight increased work of breathing, but otherwise were fine. So then when I go in to give that feed and there's increased work of breathing, I might misinterpret that. So how do we make sure that tolerated well is documented well? Because what you're really writing when you write tolerated well is your conclusion. That based on the information I had about the patient when I did the procedure that I was going to do, they tolerated it well. But that doesn't tell anybody else who may not have the same information as you how they tolerated it. So when we go to document, the useful part of the documentation is the actual assessment that supports your conclusion. So you don't necessarily need to chart more, but you need to chart more clearly.